Good day, everyone. In this video, we are going to study the stringent differentiation of the four levels. The stringent differentiation of the four levels is the differentiation according to the weight level, qi level, yin level, and blood level. We're going to see the human body in these four levels. This method is primarily used for externally contracted warm febrile diseases. The warm febrile diseases also sometimes translated into warm diseases or febrile diseases. So this diseases, the cause of these diseases mostly related to the heat, and the manifestations the patient will have fever. So that's why it names after febrile. Similar to the sixth meridian differentiation, at the beginning of the discussion, four levels and Sanjiao differentiation method, we're going to introduce briefly the backgrounds of these two differentiation methods. These two differentiation methods were developed in 16th and 17th century. Each theory, actually all theories, the development of all theories has their own backgrounds. The reason is because Chinese medicine and acupuncture, the practice and the theory, we see patients directly from the clinics. We didn't do any lab experiments. We don't test anything from the labs. We see patients from the clinic directly, which means in order to gain your experience, in order to improve, to develop the theory, we must see the patient from the clinics. We must see the development of the diseases. We must analyze and then develop into a new level or even a new theory, which means all theories developments will have their social backgrounds, such as the sixth meridian differentiation method. In the prefix, the author wrote that the backgrounds of the book. In 16th and 17th century, what happened in China at that time, there were many disasters and pandemics recorded. The Chinese culture is one of very special cultures in the world. The Chinese culture sees the history very important. So each year we have someone, official officers, record the official history. What happens in these years? What happens in what's especially the important events. So as you can see, some numbers here. These are the years that's in the history records that there were pandemics or disasters. Why I put the disasters and pandemics together? The reason is because many pandemics in the past came after the disasters. This is also recorded in 黄帝内经, in the classic. In 黄帝内经, it describes that big disasters, after big disasters, we will suffer from pandemics. The reason is also because after disasters, one of the reasons is because after disasters, the hygiene is not that good. The economic is also not that good. So the hygiene is not good, and then also people will be hungry because lack of food. That's their anti-pathogenic qi also not strong. So it was more likely to have pandemics after the disasters. In 1506, 1507, 1513, the 1517. You see all these years, a few years, 2 to 5 years, there were pandemics or disasters in China. So these social backgrounds help the development of the Chinese medicine and acupuncture. The reason is because of these pandemic. The cause of these pandemics mostly are related to the heat. And then the previous development, the sixth meridian differentiation. When we introduced, we said that the sixth meridian differentiation mostly is used for cold-induced diseases. But now the disaster, after more than 1,000 years, the climate, the weather has changed. Also, the society changed. So at that time, in 16th century, in 15th century, 17th century, the disease, the causes of the disease, mostly related to the heat. So the practitioners at that time used the previous treatments, the previous theory to treat the diseases. The results sometimes were not that good. So they studied and developed into a new theory. That's the 4 levels and the Sanjiao differentiation method. Also, after the study, you also will realize that although these different names, differentiation method, they also link to the previous ones. Synging differentiation, the 4 levels, the Wei defensive levels, the Qi level, Ying level, blood level. So these 4 levels actually they refers to 2 levels, which are the Qi level and the blood level. Also, when we study the 6 meridians, I gave you a line between the Yang and Yin. The Yang meridian center and the Yin meridian center, the disease, the pathogens, develop into a deeper position of the human body. From Yang position goes to the Yin position. In other words, from exterior and develop into interior, from Yang to Yin. So the 4 levels also very similar. Although we have 4 levels, but when you separate them, you also can be 2 levels, the Qi level and the blood level. When we compare with the Qi and the blood, the Qi is the Yang, the blood is the Yin. The reason is because Qi is foundless, blood is found. So we can see the blood, but we can't see the Qi. The Qi level also superficial compared with the blood level. So from this theory, we actually think about the human body from 2 levels only, Qi and blood. But Qi levels is too broad to diagnose. Also, if you diagnose Qi level, it's too vague. So from the Qi level, we're going to separate them into Wei defensive level and Qi level. From these 2 divisions, we can identify closer to the area where diseases happened. The blood level, we also divided into Yin level and blood level. So this is very similar to the 6th meridian, Qi level, from the superficial and also refers to yang. The blood level refers to yin and also goes deeper. So from wei, qi, yin, and blood, this is the direction of these four levels. The diseases also keep develop further and further, goes more to the interior. The pathogens can attack the weight levels directly. This is also very similar to the Taiyang syndrome. The only difference is Taiyang syndrome is cold-induced. Weight level syndrome mostly heat-induced. The pathogen also can go to Qi level directly or Yin level. The development, if a patient suffers from disease from Qi level and it wasn't healed, the disease may develop into Qi level and then develop into Yin level, even in the blood level. The pathogen in the weight level also can develop into Yin level directly or blood level directly. So from this diagram, you will see the causes. Where does the pathogen come from in each levels? The levels, don't be confused by the name. We also, these just different names. You can name A, B, C, D levels. And then we're going to study the symptoms and the manifestations of each levels. And also we're going to see how do you know the pathogen in which level, what's the key manifestations in each level. Weight defense level syndrome. This manifests as an bacterial heat syndrome. So this is very important. This is different from the cold-induced syndrome. Due to the failure of lung defense to disperse, lungs defense. So that's the bacterial heat pathogen affects the lungs function, results in the lungs problem. So the patient will have a fever, mild chills. That's because the cause of this problem is the heat. The patient may have headache, nasal obstruction, dry mouth. That's due to the heat. Mild and thirsty, coughing. These manifestations are due to the heat affect the lung. So from the weight defense level, you will see that mostly our body were affected, especially in the lung. The tongue has a red tip. That's due to the heat with a thin coating. So the coating is very important. In weight level, the coating is thin. Also, a thin coating in the tongue diagnosis, we also know that a thin coating presents with a superficial and mild syndrome. Then the weight level, also superficial, bacteria, also mild. The pulse is floating, superficial, and rapid. Rapid is because of the heat. So these are the analysis of these syndromes, these manifestations. The key points is the red tongue, especially the red tip with a thin coating. The pulse will be floating and rapid. The Qi level syndrome. The Qi level syndrome manifests as an interior excess heat syndrome. So as you can see from the weight level, when the pathogen develops into a Qi level, we see that the pathogen actually developed from an exterior to an interior. So the pathogen goes deeper in the body. When the pathogen goes deeper in the body, it will affect the organs. It will affect the organs of function. So the patient will present with fever, aversion to heat. That's due to the cold pathogen, the heat pathogen, restlessness, thirsty, sweating, scanty urination. So these are due to the heat. The tongue is red with a thick coating. The pulse is rapid. So the key manifestations here, the tongue with a thick coating. So because you can see from the tongue and the coating, so the differentiation between the weight level and the qi level, it makes us much easier to study, because there will be it will be very obvious to observe a thin coating and a thick coating from the tongue. So when you see a thick coating in the tongue, you will know that the pathogen already developed into a deeper level, already affects the organs of function. When you see a thin coating, you will know that the pathogen still in superficial, still in mild level. And then the prognosis also can be good for for thin coating. So that's the difference between a weight level and qi level. These two are all from the exogenous heat, so the tongue will be red. If the tongue is not red, then you need to think about the other problem. Is there any dampness? Because the body constitution can change the heat into cold. So if you see some symptoms that are conflicts, you need to think about the causes. Think about the actual causes of the pathogen or the body constitution. So from the qi level and the weight level, the patient will have coating, but one is a thin coating, the other one is a thick coating. The patient can present with cough. The patient can present with sadness or restlessness, tidal fever. That's also due to heat. This tidal fever, the patient can feel more pronounced in the afternoon. When you see this description, do you remember anything in the sixth meridian differentiation? Which symptom we can see a tidal fever pronounced in the afternoon? The Yang syndrome. So the Yang syndrome and the qi level syndrome, there are some similarities. The patient may present with pain in the ribs area, bitter taste, retching and wiry rapid pulse. This is because of the heat. The key manifestation here is the coating. The patient will have a thick coating. And then, is it a thick yellow or a white thick coating or a yellow thick coating? It will depend on the pathogen and also depends on the patient's body constitution and the accompanying manifestations. If the patient presents with a white thick coating, you need to think about if any coldness or yang deficiency in the body, or even dampness from the yang deficiency or not. If the patient presents with a yellow thick coating, it might be the heat. And you also can see, is it a coating dry or moist? So you can see, has the body fluid been affected or not? So as you can see, we actually use the knowledge in the tongue diagnosis to analyze these manifestations. So the key manifestations is the thick coating, and because of the heat, the patient may present with different manifestations that's due to heat, such as the dry stool or constipation or diarrhea due to heat. So the manifestations can be varied from each patient, but the coating must be thick coating. That's the in Qi level. If the patient didn't receive well treatment, or if the pathogen attack the blood or the Ying level directly, the patient also can present with the Ying level syndrome, the Ying nutrition level syndrome, also due to the heat. When we use warm heat, exactly the same as heat, just use different words to describe the different level of heat. So warm is less heat, the heat is more heat. So that's the only difference. You can use either one, or even pathogenic fire also acceptable. The heat consuming the Ying nutrition, it disturbs the heart and mind. So for this syndrome, the pathogen goes to the Ying level. So this Ying is this Ying level. The Ying level, the patient will present with fever that's worse at night. The reason why the fever will be worse at night, we think about that at night. During the day, we got Yang. At night, we have Yin in the environment. And the pathogen goes to the Yin level. And in the evening and night, the pathogen will have backups from the environment, which means at night, the, the pathogen is more violent. So the fight, the struggles between the antipathogenic Qi and the pathogenic Qi will be more severe. So that's why the fever will aggravate at night. Mild thirsty, restlessness, insomnia. Why the patient presents with mild thirsty? In Qi level, the patient will present with thirsty desire to drink. The reason is because that the pathogen goes to the Yin level. The Yin level is the blood level. The blood and the body fluid are different. So in this situation, the blood is affected. The body fluid might be affected or not. So the patient may present with mild thirsty. In severe cases, the patient may present with unconsciousness, macular rashes, the rashes. So the skin disorder. The skin disorder in our theory, we also think that's the sign of the heat. Most importantly, tongue is deep red with all red with no coating or less coating. So in Yin and blood syndrome, in Yin and blood levels, the patient will present with manifestations without the without coat with no coating. The tongue is deep red. That's because the heat goes to the blood level. Deep red is the color of the blood, and then most importantly, there's no coating. Also in the blood level, also no coating. So the key manifestations, a deep red tongue with no coating. And then if the pathogen still didn't treat well, the disease may develop into a blood level, develop into a deeper syndrome. The blood level, when it develops into the blood level, the patient also may present with deep red tongue with no coating. So these two, Ying level and blood level, the tongue will be deep red with no coating. And then how can you distinguish from the Ying level and the blood level, since they have similar manifestations on the tongues? In the blood level, the patient will have some bleedings under the skin, bleedings in the intestines, bloody stool, or bleeding in the urine, bleeding nose, bleeding in the eyes, bleeding in the tongue, any kinds of bleeding. When it goes to the blood level, the patient must present with some kinds of bleeding, although some bleeding we don't see, such as the bleeding under the skin. So what we can see just the purple rashes. This is some of the images that we have seen in the inspection, especially for the skin disorder. We have seen some skin disorder, the kinds of bleeding under the skin, that you can see a purple or dark red spots under the skin. When you palpate, you don't feel something protruding. That kinds of so it's similar to the bruise. This is the blood level. So in this situation, the bleeding also due to the heat. That's because of the heat can promote the blood movement in the vessels, and excessive blood movement in the vessels can result in the movement that the blood move out of the vessel. The excess heat also can burn the vessels, so we also may result in bleeding. The patient may present with fever, also aggravates at night. So from these four levels, it is, a, it is not hard to differentiate the different levels. From Qi levels, the patient will present with a foam coating. From Wei level, the patient will present with a foam coating. From Qi level, the patient will present with a thick coating. In Yin and blood level, the patient will have no coating, but in the blood level, the patient will have some bleedings. So that's the key manifestations of these four, and the rest of the manifestations you can just go through by yourself. There's one patient, 31 years old female, presented with clinic with fever 4 days. Also caught a cold, as fever avoiding to cold, headache. Thirsty, for prefer to drink cold water. Red tongue with a yellow coating. So this patient is also from the exogenous pathogens. aversion to cold. After now, the patient presents with a thirst and desire to drink cold. This can reflect excessive heat in the body. A red tongue with a yellow coating is actually a yellow thick coating. Surgeon and rapid pulse, that's excessive heat. So this syndrome is the Qi level syndrome. The Qi level syndrome, we're going to use the herbal medicine to reduce the heat in Qi level. We're also going to localize the organ location in future. In this video, we have introduced also very briefly of the differentiation method of the 4 levels. The study of the 4 levels differentiation, especially with its applications. So how to apply the 4 levels in all different kinds of diseases. This content also a full year course. So this is very similar to the 6th meridian differentiation method. We're going to study briefly, we're going to introduce briefly, and then you will have a general idea, because from these 4 levels, sometimes it can help you to identify, such as if you remember a thin coating in the weight level, that reflects in the exterior syndrome and mild syndrome. So you will know that the patient presents with counter UV fever with a thin coating, that's not dangerous. A patient with bleeding, with a red tongue with no coating, you will know that in blood level, that's not easy to treat. So these some key thinking can benefit your clinical practice. If you are interested in, you also can find more references on the 4 levels. The 4 levels differentiation and the Sanjiao differentiation that we're going to introduce in the next video are all related to the heat syndrome, mostly related to the heat syndrome, and the heat syndrome may affect the consciousness. That's because the heat may affect the heart. Then again, you locate it. The different differentiation locates in the Zangfu organs as well. Also, the Qi level. When we talk about the thick coating in the Qi level, the thick coating, where does the thick coating come from? The thick coating is from the dysfunction of the internal organs. Which organs them? Especially for the spleen and stomach function. This is why it will result in the excess fertilizer. So do you still remember that in the tongue diagnosis, we explained that how a patient can develop into a thick coating, why the grasses in your garden grow too overgrow or grow too well. That's from the thick coating. So this also a abnormal situation of the spleen and stomach. So as you can see, now the 4 levels also link to the Zangfu organs. So these differentiation methods you can use as a combination. You also can use separately, but just from different way to see the diseases. Thank you for your attention.